So the diagnosis of PDA is based on echocardiographic assessment, which is anatomic as well as the flow parameters. So it involves assessment of the duct characteristics, which may be the size of the duct, the nature of the shunt, whether it is right to left or left to right or bidirectional, and the flow velocity can be measured as well. The shape of the duct is quite variable, as we will review next, and that's one of the complications of why the measurement may not exactly be accurate, because it depends on the shape and the direction of the shunt. There should be an assessment of pulmonary overcirculation and overload of the left heart. So these measures may include left atrial dilatation and the LA-AO ratio or left atrium diaortic ratio. Normally we take a LA-AO ratio more than 1.4:1 as significant for the duct. The size of the duct which is significant can vary according to the gestation. So anything more than 1.5 millimeters in the extreme premature, and anything more than 2 millimeters in the bigger premature babies can be considered. There is also an assessment of the ductal steal. The ductal steal is nothing but a reduced perfusion to the lower half of the body in the postductal part of the aorta, because this blood gets shunted through the duct into the pulmonary circulation. So this overloads the pulmonary circulation and deprives the lower half of the body of some blood flow which is meant for it. This mainly affects the gut and the kidney perfusion. So this illustration is a Krichenko classification of the PDA, and this shows the different shapes and sizes it can take, and the elongated type, you can have the conical type. So the shapes make it different also when we come to the device closure. So a characteristic assessment is important, and when you do the echocardiography, depending on where you measure it, if you catch the wide part of it or the narrow part of it, it can make a difference to your size measurement. And it's also important to remember that this is not a fixed structure, it keeps changing. The shunt direction may keep changing, it's very labile, the size may keep changing. So what you're getting is just a point estimate in a very labile structure. So you cannot put undue importance in the measurements, but the overall assessment and the group of baby you're treating becomes very important.